increase your risk of getting diabetes and hypertension and other problems that are all detrimental to your health. So let's take note and avoid bleaching. As Dr. Uncle said, black is beautiful.
Dr. Anko said, black is beautiful. Black is beautiful. And the doctors say, don't use steroids. Don't use steroids. So we'll try and do what we call the myth of fact segment. The myth of fact segment, where we'll attempt to debunk some of the myths and facts when it comes to glaucoma. So the first myth and fact comes to Dr. Ebua. Myth or fact? 1. If I can see clearly, I cannot have glaucoma. Myth or fact?
That's a big myth.
Okay.
Okay. So if I should explain. So as Otanko mentioned earlier, what glaucoma does is stealing your side vision. So as we're looking straight ahead, you can see clearly, but your vision all around you may be gone. And by the time you realize that your vision is gone, the glaucoma is far, far advanced. So the fact that you can see clearly does not necessarily mean that you do not have glaucoma. And unfortunately, almost half of our patients, by the time they come, they are already blind in one eye, and then about 1 out of a 5 are blind in both eyes. So that's the problem with glaucoma. You might not feel anything, no pain, no redness, except the angle closure type. But the one that is more common in our part of the world, that is the open angle type. You might not see anything. By the time you realize all your vision is gone. And then because it starts on the sides, so usually people will come that, oh, when I'm driving and a car is coming from my side, I don't see till the car is very close to me. So that is, or when they, let's say, coincidentally close or accidentally close one eye, and they realize that, hey, all this while I haven't been seeing from the other eye. So the fact that you can see with both eyes doesn't mean you do not have or you cannot have glaucoma. Thank you.
So that is a myth. That is a myth.
Please, can I add something to you too? And also, I think about 90% of those with glaucoma in our part of the world are undiagnosed, and they are not even aware they have glaucoma. So yes, there are a lot of people walking around who think they can see, who think they have clear vision, but they don't have clear vision.
Hey, but that's scary, Doc. That's very scary, Doc. So what do we do about that? Before I go to my next myth or fact, a lot of people are getting really scared now. I thought you are saying that 90% of people are walking around and they don't even know they have glaucoma. Doc, that's very scary. What do we do?
As I said earlier on, I think the main thing with glaucoma is, in fact, I didn't go through the signs and symptoms of glaucoma. But as Dr. Ebo already said, it doesn't give you anything, doesn't show you anything, doesn't give you eye pain or anything, unless it is an angle closure that is acute. Like have a sudden build-up of pressure in your eye that you have pain. So the only way you know that you have glaucoma is to get your eye screened. If you are between 20 to 30 years, every 2 years, pass through the eye clinic, get your eye examined. If you wear glasses like me, get your eye examined. If you have any eye problem and you were a young person in your 20s or 30s, you have eye problem, you go to the eye clinic, let them examine your nerve. Okay, let them examine your nerve. And if you are 40 years or 30 and above, every year go to the eye clinic, get your eye examined. Or you can even make it your part of your birthday gift to yourself. Get your eye examined. And if you have a positive family history, every year, get your eye examined. When I say examined, not just using a torchlight or anything, to get your pressure checked, get your discs examined to see if you have glaucoma. And when you are going, carry your family along.
Thank you so much, Doc. If you are now joining us, this is the Kolebu webinar series, the June edition. A lot of people on our platforms are very happy with all the education you are giving us. There's a Lizzie Che who says that regular media interaction on TV and radio will help to educate the public. Thank you very much, doctors. There's another individual here saying, thank you for educating the public. So we will go back to our myth or fact segment. So Dr. Akese, myth or fact? Only people with a family history are at risk of glaucoma. Myth or fact?
So that's a myth. Anybody can get glaucoma. Sometimes people are in your family, they have glaucoma, but they are not aware. So you cannot base your screening or how frequently you get your eyes checked based on people in your family. So as Dr. Anko said, screening is very important. It's not a one-time screening. You have to go periodically to get your eyes checked.
Okay, you have to go periodically to get your eyes checked. That is what the doctors are saying. Dr. Anko, myth or fact? Most patients are asymptomatic until advanced disease.
That is a fact. That's a fact. As I showed on the picture, the normal person has a very wide field of view they can see. But in the only time you notice that you can't see, that to prompt you to seek attention is when it's advanced, that now you have what you call a tunnel vision. Tunnel vision, that you are walking around and you are bumping into things, or as Dr. Yabua said, you are driving and you see suddenly somebody crossed you. The other person might probably be in your peripheral view all along, but because you couldn't see, you think that the person just jumped into your view. So glaucoma is asymptomatic, and you only have symptoms when the disease is very, very advanced.
Okay, thank you. We'll take our last one for Dr. Yabua. A glaucoma diagnosis means you will definitely go blind. A glaucoma diagnosis means you definitely go blind. Myth or fact, doctor?
It's a myth.
Okay.
So, yes, as we mentioned earlier, glaucoma cannot be cured, but it can be treated. And our aim of treating it is to prevent the blindness from coming. So the fact that you've been diagnosed with glaucoma does not necessarily mean you go blind. Yes. So we treat it with the aim of preserving your vision. So what is left, we are preserving it so you don't go blind. Yes.
Thank you.
And I think we should stress the last part of a point, because we've had patients who come and say, so doctor, if I use the drops, will I see better than I'm seeing now? The main aim of the management of glaucoma is preservation of what is left. What has been damaged, unfortunately, we can't, as of now, scientifically, we can't bring back. But our aim is to preserve what you brought to us.
Okay.
Can I add that?
Yes, please.
And that goes on to buttress the point about early screening. Because for us, unfortunately, by the time most patients come, they're either blind in both eyes or one eye, or is severely gone, or is advanced. So if you come at that stage, what is left is what we are preserving, we are saving. But what is lost cannot be recovered, unfortunately. Yes.
Okay, thank you very much. If you are now joining us, you are welcome to the Kolebu webinar series, the June edition. We have one question coming in from the social media platforms. Can a person have glaucoma with normal intraocular pressure? Dr. Kese, can a person have glaucoma with normal intraocular pressure?
Yes, you can have glaucoma and your eye pressures are normal. Although we say that normal pressure is between 10 to 21 millimeters of mercury, some people are their pressures are within the normal range, but still it's too high for them and they still have damage to their nerves. So it's a form of glaucoma. As Dr. Anko said, there are different types of glaucoma, and there's one that is called normal tension glaucoma. So just checking your IOP when you go for screening is not enough. Your eyes must be dilated, and so that we take a good look at the nerve and see whether there are changes that are resembling those that have glaucoma. Once we see that, we start you on medications.
Okay. Thank you very much. We are being joined here by a panel from the Lions International Eye Center, Kolebu. the Lions International Eye Center holds an annual research fair. And this year, they will be having the 8th annual research fair on 26th of June 2026 at 9 a.m. to 12 p.m. The venue is the Eye Center Conference Room. The theme for this year's 8th annual research fair is From Data to Delivery, Advancing Patient-Centered Eye Care Through Research. From Data to Delivery, Advancing Patient-Centered Eye Care Through Research. It will be wonderful if individuals interested in research can join the eye care team to have this wonderful research fair tomorrow, the 26th of June 2026, at the Lions International Eye Center. So the next batch of questions we are having coming in is, if glaucoma runs in my family, how often should I be screened? Dr. Eboa.
Okay. So a positive family history, and it could be because something called first degree relatives. So first degree relatives are your parents and your siblings. And then also even evidence have shown that second degree relatives, that's your aunties or your uncles and your cousins. Any of these people I've mentioned, if any of them have or have been diagnosed of glaucoma, it puts you at risk of getting glaucoma. Some research have shown that your chances of getting glaucoma is as high as 9 times as compared to somebody who doesn't have any family member with glaucoma. So for such individuals, we advocate that, or it's advised that they get their eyes screened every year. So every year, get your eyes checked by an ophthalmologist. So proper, thorough eye examination. And then if something is detected, it can be further investigated. If nothing is detected, then you come annually. Sometimes if you are suspected, then you ask you to come every 6 months for further evaluation. Yes. So yearly, and then if nothing is detected, continue yearly. If something is detected, every 6 months, we see you.
Sorry, something is coming as a follow-up to that. So are you saying changing my glasses every year doesn't mean that I'm having my intraocular pressure checked?
Okay, so that brings to the point of the various forms of eye caregivers in the country. So we have ophthalmologists who are medical doctors who have undergone further training to become eye specialists. So they provide eye care and they perform surgeries for various forms of eye problems. And then we have optometrists. So optometrists are doctors of optometry. They are not medical doctors, but they've been trained to provide some form of primary care, so basic eye problems. And their main focus of training is to solve spectacle related problems. So you may go for annual or twice every 2 years, you go for your renewal of your glasses, but does not necessarily mean that you are being screened for glaucoma. So let's take notes. So you have to request that, or you have to seek proper screening from an ophthalmologist. But having said that, the optometrists too sometimes take a look at the back of the eye and check your pressures too. And if they find anything suspicious, you are supposed to be referred to go and see an ophthalmologist. So you can request for it, yes.
Dr. Kese, can children develop glaucoma?
Yes, children can develop glaucoma. So we have something we call congenital glaucoma, and children right from birth, they can have that condition. But fortunately for children, usually when they have that conditions, there will be signs. Those below 3 years, sometimes the cornea, there's a covering on the brown thing in the eye. It's called the cornea. It's supposed to be clear. But for those children, you realize that now they look a bit whitish. Their eyes become bigger. There's a lot of water coming out of their eyes. So luckily for them, you can quickly pick up those signs and send them to the hospital. And for those children, it's because that where the water is supposed to leave the eye did not form properly. So that is why they are having such conditions and such problems. Aside that, for older children, they can have glaucoma. that does not come with signs, and we call that juvenile open angle glaucoma. You realize that those cases, they have a very high eye pressure, and usually we do surgery for them. So it's important that older kids above 3 years and above, you take them also for eye screening.
The bleaching matter is not leaving you, Dr. Anko. Apart from bleaching, what other lifestyle should I avoid?
So maybe I'll mention a few, then my colleagues will add up. So as I mentioned earlier on, one of the things that can that predisposes you to ocular injury. Ocular injury. For instance, as I said, we are fond of partaking in some form of play or games that tend to put us at risk of injuring our eye. And as I said earlier on, for our people, our workers who are involved in menial work, these menial jobs or manual jobs, please use goggles. Adopt that practice of using goggles. If you know the kind of work you do can easily lead to trauma to your eye. Then also, the best culture to develop, I think, in my view, is the screening. And as much as you are scared of stroke and other things, okay, let your eye also be important to you. Because if you close your eyes right now and they tell you to walk in your room, I don't think you can take more than 3 steps without falling. That's how bad glaucoma is, if you should go blind from glaucoma. So the best, aside the two that I've mentioned, I know my colleagues might add some, I think the best lifestyle thing you should take, you should get screening. Make it a gift to yourself that I'll check my eyes as often as possible. I don't know if Dr. Eboy and Akeso have anything to add.
You've buttressed on the most important point. But if the person wants to know if there are other good lifestyle that they can adopt for the eye, then usually when I'm confronted with this question, what I usually say is that whatever is good for the goose is good for the gander. So all the therapeutic lifestyle changes that I usually emphasize on, like eating balanced diet, eating food that are rich in vitamin A, C and E, zinc and copper. So for our part of the world, sweet potatoes, contomere. So anything that is good for the body is good for the eye. But this does not specifically influence whether you get glaucoma or not, but it's good for your general well-being. But the most important thing is adopting early care-seeking behavior. So if you have a problem, you don't cut corners, go to the pharmacy, see people who are not qualified, but seeking help from qualified caregivers. Yes. I don't know, Dr. Kessie, you want to add more to
There's
that?
something here she could address. Are herbal remedies effective in treating glaucoma?
So far, research hasn't shown any correlation between controlling glaucoma and using herbal medication. In fact, some of the herbal medication are actually harmful to the eye. So it's best to stick to your prescribed medications at your eye clinic and avoid these things that we buy and use. We don't know what it contains. We don't know where they are from. And some of them actually cause more damage than good.
Okay, thank you so much. If you are now joining us, this is the Kolebu webinar series, the June edition. We are discussing glaucoma. So if you could leave the audience with one key message about glaucoma today, what would that be, Dr. Yeboah?
Okay. So if one thing I will leave with our audience today is glaucoma is real and is very, very, very prevalent in Ghana. And so always make it a point to get your eye screened. As Dr. Anko said, at least you can add it to your annual medical screening, attach it to your birthday so that you don't forget. Thank you.
Dr. Akese?
For me, one thing I would like everyone to take note of is that glaucoma is a serious disease. And unfortunately, it will be stealing slowly over a long period of time. Before you realize that you have glaucoma, it has stolen a lot from you, and it has stolen so much that we cannot recover what is lost. Thank you.
And I would also say that being on medication alone without review or follow-up is not enough. Okay, it's not enough. So even if you report and we start you on medication, we start you on treatment, please stick to your appointment. And I will still add to what Dr. Yeboah said: screening, 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 screening. Because that's the only way. If you've not been diagnosed with glaucoma, you will know that you have glaucoma.
Thank you very much. This is the Kolebu webinar series. The 8th annual research fair is being organized by the Lions International Eye Center. The theme for this year's fair is From Data to Delivery, Advancing Patient-Centered Eye Care Through Research. It's happening tomorrow, the 26th of June, 2026, 9 a.m. to 12 p.m. at the Lions International Eye Center Conference Room. If you just joined us, we are wrapping up our discussion on glaucoma. We were joined by a panel of doctors from the Lions International Eye Center. They have taught us everything we need to know and understand about glaucoma. Bottom line, screening, screening, screening. My name is Dr. Akofa Lasse, a glaucoma resident in training at the Lions International Eye Center. Thank you very much for joining us.
In training. Have you heard about glaucoma? Do you know that glaucoma is the leading cause of irreversible blindness worldwide? And the prevalence, that is the number of people with glaucoma, keeps going up each year. And do you know that Africa ranks high in the world and Ghana ranks high in Africa? And the glaucoma was chika semo friend him Friday. Our chede ni Friday obe him tau who the bibiriel na when you ifra. It's better we invite Obi Biara about Kolebu webinar on glaucoma. So come this 25th of June, Kolebu will be holding a webinar on glaucoma at exactly 3 p.m. on all our social media platforms, Facebook, YouTube, and all our Zoom links. But then we will be Biara. Invite someone, invite a friend. But then we will be Biara. Come all. Thank you very much.
Hello everyone. My name is Dr. Akofa Lasse. I'm a specialist ophthalmologist at the Lions International Eye Center, Kolebu, currently a glaucoma fellow in training. This month, as part of the Kolebu webinar series, we'll be discussing glaucoma. I'd like you to know that glaucoma is traditionally described as the silent thief of sight. Why? Because you can lose your vision without knowing it. Riding on the back of that, we would like to delve into the nitty-gritties of glaucoma. Join us on the 25th of June at 3 p.m. on all Kolebu social media channels, Facebook, YouTube, and Zoom links. So you don't want to miss this. I'd like to see you there.
Hello everyone, I'm Dr. Yeboah, an ophthalmologist at the Lions International Eye Center and also glaucoma fellow in training. Have you heard about glaucoma? Do you know that glaucoma is the leading cause of irreversible blindness worldwide? And the prevalence, that is the number of people with glaucoma, keeps going up each year. And do you know that Africa ranks high in the world and Ghana ranks high in Africa? And the glaucoma was chika semo friend him Friday. Our chede ni Friday obe him tau who the bibiriel na when you ifra. It's better we invite Obi Biara about Kolebu webinar on glaucoma. So come this 25th of June, Kolebu will be holding a webinar on glaucoma at exactly 3 p.m. on all our social media platforms, Facebook, YouTube, and all our Zoom links. But then we will be Biara. Invite someone, invite a friend. But then we will be Biara. Come all. Thank you very much.
Hello everyone. My name is Dr. Akofa Lasse. I'm a specialist ophthalmologist at the Lions International Eye Center, Kolebu, currently a glaucoma fellow in training. This month, as part of the Kolebu webinar series, we'll be discussing glaucoma. I'd like you to know that glaucoma is traditionally described as the silent thief of sight. Why? because you can lose your vision without knowing it. Riding on the back of that, we would like to delve into the nitty-gritties of glaucoma. Join us on the 25th of June at 3 p.m. on all Kolebu social media channels, Facebook, YouTube, and Zoom links. So you don't want to miss this. I'd like to see you there.
Hello everyone, I'm Dr. Pat Yeboah, an ophthalmologist at the Lions International Eye Center